Millions of people across Brazil are facing gaps in their health care as thousands of Cuban doctors leave the country. It follows a standoff between Brazil's president-elect and the Cuban government. So what's next? I'm Malika Bilal and you're in the stream. Send your thoughts via Twitter and YouTube. He doesn't take office until January, but already Brazil's president-elect wants to renegotiate a major deal with Cuba. Last month, Jair Bolsonaro pushed for changes to the Mais Médicos, or More Doctors program, under which Cuban doctors provided health care in poor regions of Brazil. But Cuba pulled its doctors out rather than accept Bolsonaro's demands. Al Jazeera's Victoria Gatenby has more on the impasse.
The More Doctors program was started in 2013 by former President Dilma Rousseff. Since then, 20,000 Cuban doctors have worked in Brazil, including in 700 districts that had never had a resident doctor. But the program is controversial. Cuban doctors are paid less than their Brazilian colleagues. Brazil pays Cuba around $3,100 a month through the Pan American Health Organization for each doctor. The doctors themselves receive only about a quarter of that. The rest goes back to the Cuban government. Bolsonaro blamed the collapse of the program on the Cuban government's intransigence, tweeting, "We condition the continuation of the program More Doctors on the completion of skill tests, full salary payments to Cuban doctors, much of which now goes to the dictatorship, and the possibility for doctors to reunite with their families." Unfortunately, Cuba refused.
So what does Cuba's exit from the More Doctors program mean for Brazil and for Cuba? Joining me today from Sao Paulo to discuss this is Paulo Abachi. He's a doctor who served as an advisor to Cuban doctors working in indigenous regions of Brazil. Arturo Lopez Levy is an assistant professor of political science at Gustavus Adolphi College. He's also consulted the Inter-American Dialogue on matters of Cuban policy. He joins us from St. Peter, Minnesota. Luis Facchini is a primary healthcare research coordinator at the Brazilian Association of Collective Health, also known as Abrasco. He joins us from Pilotas in southern Brazil. And in Miami, we have Nora Gamas Torres. She's a journalist at the Miami Herald who has reported extensively on Cuban affairs. Welcome, everyone, to the stream. I want to start with a few words from the president-elect, not even in office yet, and he's already calling something slave labor. That is how he describes the arrangement with Cuban doctors, saying he couldn't agree to it. Slave labor, Luis, is that something you can understand? Where does that come from? Those are strong words.
Oh, yeah, this is a very great problem in our country. I don't know that the Cuban doctors are slaves. We have a lot of problems related to slavery in Brazil, infant slave, and even working in rural areas that are slave. This is a cooperation between two governments, two states, and I think that they can respect all the rules that are established between Brazil, Cuba, and the PAH, the Pan American Health Organization.
There is a view that would not agree with the president-elect, of course, and as you're saying there, we got a video comment from one of those people. His name was Raymond Garcia, and he is actually one of those doctors. He's a Cuban doctor in Brazil, and this is what he told the stream.
My name is Raymond. I'm Cuban. I have a son who was born here in Brazil, and a wife. My son and wife are Brazilian. Cuba ended this program without considering that I have family here, without consideration for the patients here. They didn't think about the vulnerable people here who need healthcare, not for one moment. There was no advance warning, nothing.
2018.
Arturo, you heard what he said there. Give us the view from Cuba, or Cubans, as to Bolsonaro's comments and the idea of this program in the first place.
Malika, I think that the big challenge here is to strike a balance between the human right to health of entire populations and the right of healthcare professionals to their own careers. And the position of President Bolsonaro, President-elect Bolsonaro, was maximalist. He didn't leave a space to any area of a negotiation. He basically said that on the first day, everything that was agreed between PAHO, the Pan American Health Organization, the Cuban government, and the previous Brazilian government, not only those on the left, but even the government of Michel Temer, that everything of this will be ended. I think that the majority of the patients and these healthcare professionals, most of them nice people and people that would like to receive the healthcare or provide it, are caught in this political polarization in which I'm not saying that the Cuban government is completely on the right, but the detonator of this crisis is the absolutist position of President Jair Bolsonaro.
I hear you there being caught in the middle of this politicization. I wanted to share a few comments that we've gotten from people in Brazil who say they've worked with Cuban doctors. This is Sheila. She says, my daughter, who was allergic to insect bites, was helped immediately by a Cuban doctor at his home because there were no other doctors in the town. Sheila goes on to say he talked, laughed, made my daughter laugh, offered water and coffee, and said he would be available at any time. I only had to go there once, but everyone who went there was well taken care of. You could feel the love for the profession. So, Dr. Paulo Abachi, I want to go to you with this. Talk to us about why this program was in place in the first place. Why did Brazil need Cuban expertise?
Okay, I think Cuban doctors have a great ability to adapt to different health scenarios in Brazil. They can get easily knowing territories and make plans for intervention very quickly in health primary care. So the Cuban doctors also create links between communities, even indigenous communities, but riverine communities and suburbs in major cities. Very quickly to provide good access. So I think for Brazil, it's a problem because we offer the good care. We improve some health indicators like access in health, like appointments, like referrals. So we have a big problem now without Cuban doctors in Brazil.
I think someone online would agree with you. This is Thiago. We received several comments from people in Brazil, and we've translated them from Portuguese. Thiago says, I was serviced by a Cuban doctor today. One of the few doctors I've seen be really worried about the patient. I hope he can stay here. On the other side of that, though, we got this comment from Yasmin, who says, people complain about mais médicos and forget that medicine is super elitist and that the people who get this degree, they don't want to work in a public hospital with bad infrastructure. So she seems to be, Luis, there pointing to the idea that Brazil couldn't find qualified Brazilian doctors to work in some of these rural communities.
Yeah, this is a good challenge, a very important challenge. More doctor program, and particularly the Cuban doctors play a crucial role in the Brazil health system, the universal health system in Brazil, improving the coverage, primary health care coverage, improving the access to medical consultation, especially in remote areas, especially in poorer areas, in vulnerable people, reducing hospitalization for primary care sensitive conditions, decreasing the referral to specialists, the request of medical tests and labs. And this is a really important, crucial problem in Brazil. The Brazilian doctors that are going to more doctor program generally are the newly degree doctors, the nearly graduated doctors, and they have less experience and preparation related compared to the Cuban doctors. And this is really a good problem. We need to improve the quality of primary health care in Brazil, put enroll all the activities related to more doctor program, related to the improving the curriculum in medical schools, improving the residence in family health strategy, and especially the technical supervision all the days in the primary health care services.
Until that happens, though, that is a wish list that is pretty long, and unfortunately, some say not anywhere near happening. Until that happens, we're going to further complicate matters just a little bit. Take a look at my screen here. This is from the Miami Herald. Cuban doctors who worked in Brazil sue international organization alleging forced labor. So I'll tell you a little bit about that. Now, on Friday, 4 Cuban doctors who defected from Brazil to the United States took legal action against the UN agency that brokered the More Doctors program. Here's what local media in Miami reported.
That's why we're going to take them to court.
The civil rights organization Cuban Doctors Human Rights Team filed a federal lawsuit Friday morning seeking damages on behalf of Cuban doctors who say they were forced to provide health care in Brazil. The target of the lawsuit, an organization affiliated with the United Nations called PAHO.
Of every dollar that Brazil pays for their services, PAHO, the Pan American Health Organization, sends 85% of that money back to Cuba. The doctors get less than 10%, and the Pan American Health Organization itself keeps 5% of that money from Brazil as a fee.
Lenora, you wrote that first piece that I showed on my laptop here from the Miami Herald. Talk to us about this lawsuit. Why is this program so controversial?
Well, I mean, these 4 doctors are suing OPAS, or PAHO in English, the Pan American Health Organization, which is an UN agency, because they believe that the organization trafficked in human labor and benefited from what they deem as a scheme of forced labor. The problem is, and this is the most controversial issue here, is that according to official documents, the Brazilian government was paying $4,000 to the Cuban government for each doctors. But from that, the doctors would only get $1,000. But then they even get the complete amount. They would get a part in Brazil and a part would be retained in Cuba, and they would get access to that money only if they return to the island. So basically, they're saying that they weren't being paid what the Brazilian government was paying doctors from other nationalities that were part of the program. And also they were complaining that they were curfew, that they were under surveillance by Cuban agents, that they could not travel freely. And we heard some dramatic testimonies in that press conference of doctors. One of the doctors said that the government was harassing her because she couldn't get her son to live with her in Brazil all the time, despite the fact that the Brazilian government issued a visa for her son. So afterwards, after she defected from or abandoned the program, the Cuban government retaliated against her family and evicted her family from a house she built with her money. So there are many issues which are really controversial, but specifically, I've been putting this question to the Cuban government several times, if they agree to be more transparent, say more about why that great difference between what they get and what they pay to the doctors, and I haven't been successful. They don't want to talk money.
And of course, that is exactly what everyone else wants to talk about. Go ahead, Arturo.
Malika, I think that it's important to put this in context, because although I will not dispute any of the arguments that has been made by Mrs. Gámez, I think that it will be helpful if even in this program, but also in her newspaper, we make some references at the situation of the health care at the global level. And the WHO in 2010 even has to sign a voluntary code about the international recruitment of health personnel. And there is a reality that if you look at Cuba in its geographical context, in the context of the Caribbean, 3/4 of all the nurses that graduate at the University of West Indies, that provide health care for 6 million on the Anglophone Caribbean, 3/4 of these nurses emigrate to or are recruited. They not just emigrate. They are recruited by the United Kingdom, the United States, and Canada. So the reality is that, in my view, there are some evidence that are clear that the Cuban government relations with these doctors has been very asymmetrical, and some abuses, it looks that happen. At the same time, you cannot look at this issue of the contracts and the type of agreement with PAHO without taking into account the critical problem that healthcare providers at the global level are facing critical situations like the one in the Democratic Republic of Congo, because among other things, there is a tremendous brain drain from developing countries to developed countries. Mm-hmm. So this context is important, and the international law and the code is voluntary, but express the ethics about healthcare provision in the world. And the reality is that the Cuban doctors in Brazil went there as part of a contract. It is an insult to call this slave labor.
Sure,
Arturo,
I think
if I
those
may contracts
just
are
add...
asymmetrical. Those contracts are symmetrical without question.
So Arturo,
But,
I hear you there. Let's give Nora a chance to respond, because you gave her a
yeah.
recommendation of what should be in her articles and her paper. Go ahead,
Sure.
Nora.
And it's Dr. Gámez, Arturo, not Mrs. Gámez. But anyway, so I think no one is doubting, first, the quality of the Cuban doctors, and also, like the international needs to provide healthcare. I think the issue here, and that's what the Cuban government needs to answer in particular, it's why it was keeping almost 80% of what the Brazilian government was paying the Cuban doctors. The other question that they would need to ask is where that money goes. They have said that that part of the money goes to the Cuban health system, which is public, but then there's no really oversight on the fiscal budget in Cuba, so it's very hard to find out if they're really investing that sort of money on the island.
And Arturo and Nora, Arturo, before you get back in, I just wanted to share with our audience that the binary that we find you two in is also online, because Neslihan here brings up a point that you raised, Arturo. Neslihan says Cuban doctors and Cuba's healthcare happen to be the envy of most developed nations. Another person writes in on YouTube, coming to us live. They say that they've done amazing work throughout Latin America, and even here in Portugal. We have many Cuban doctors working here in private hospitals. But on the flip side of that coin, you have people like Aiji, who says it's still an example of slave labor. Yes, we understand that they have to be taxed back in Cuba, which is fine, but not 70%. The new Brazilian government should block that deal. And I'll read one more, Arturo. Rodrigo here says this is a way for the Cuban regime to use foreign resources. The government pays almost nothing to the doctors that go abroad, but it charges a price for first world services, and it's not free. Arturo?
Well, I think that Dr. Gámez, I didn't mean any pejorative term when I call her Mrs. Gámez, but I will call her the way she wants. I think that Dr. Gámez is right when she called for more transparency on the accounts of the Cuban government, and I personally believe that, as I said before, the agreement is very asymmetrical. But notice that what President Bolsonaro say is 100% of the salary on the first day on his inauguration as president. If this is not asymmetrical, or in fact it's more asymmetrical than 20% or 30% and 70, 100%, I think it is difficult to argue that. And in reality, we need to take into account the minimum wage in Brazil, and we need to take into account the conception by which those doctors were sent to Brazil. In order to have a welfare state in Cuba, that I admit that has been deteriorating, and I would like to see more transparent standards to keep, not to dismantle this welfare state. The reality is that you need to export some of these services, and with the money that you receive from that, provide some help for those who remain at home, and they are the ones that are making the same amount of money, or in fact, less amount of money than the nurses in Jamaica or the nurses in other areas of the Caribbean, that in a situation of an open market, where you have this invisible hand that the libertarian people try to promote, the reality is that 3/4 of these nurses left the country. Do I agree that we need to take into account the professional and the rights of the healthcare provider? For sure. But at the same time, I found that the coverage of the Miami Herald and many other news institutions that has covered the issue refuse to take into account the realities that are present in every single General Assembly of the World Health Organization.
I hear you there, and I do want us to redirect a little bit, because of course this is not a discussion about the Miami Herald's work or any journalist's work. And I will say also that we reached out to PAHO, the UN agency in charge of this program, and we asked for a statement, and they did not respond. But of course that invitation is still open. I want to move here though to our community and what they're saying, because we got this tweet just now from Jake, who says the Brazilian government isn't doing much to tackle the situation. And if these doctors leave, what's next? So I will refer you to this tweet from the president-elect again, Jair Bolsonaro, who says that almost 100% of vacancies have already been filled by Brazilians. That number has been revised a bit. This just came out today, December 4th, from the Ministry of Health in Brazil. 30% of physicians enrolled in the program have actually started their activities. So Luis, I will give this one to you. Do you see these roles, these vacancies actually being filled and filled long term, not just as a stopgap solution?
It seems very difficult that all the vacancies will be filled by Brazilian doctors, especially quickly. All the vacancies that got about 97% of inscriptions, but generally the Brazilian doctors run to the inscriptions, and after some time they don't present to work. This is the evidence that we have collected since 2013. And nowadays, about this 97% of inscription, about 10% or even less are filled. And the doctors are working today in the family health strategy teams or the municipalities where they are located. Then it seems that it's very difficult that the Brazilian doctors fill all the vacancies in a quick way and in performing a good work related to the challenges regarding to the activities that they need to do in each municipality, in vulnerable population, or remote areas, in indigenous areas.
And Luis, as you're talking there, I could see you, Paulo, trying to get in. What did you want to add?
Yes, vacancies probably won't be filled by Brazilian doctors. At the moment, just 7% of vacancies filled by Brazilian doctors. Just in big cities, in major cities, in remote areas, in indigenous system of health, riverine areas, and shanty-towns of big cities, we don't have doctors in these places present to start the work. So I'm very concerned because the Brazilian government putting on the media, on the press, the vacancies is complete by 19% of doctors present, but the reality it's not. Just 7% of Brazilian doctors go to the cities, go to the municipalities to start to work. So we need another policies to resolve this problem of improvement and fixation of doctors.
Paulo Abachi, I hear you there, and looking forward to a solution. Of course, we will continue to keep our eye on this story. That's all of the time we have for today's episode. But please keep your comments coming via Twitter, YouTube, and aljazeera.com/thestream. Goodbye.